Let's go ahead and call the meeting to order. Welcome, everybody. First thing up, we're going to do, he just announced he looked at it and said that we do have a quorum, so we're ready to go. So next up is going to be our approval of the agenda.
I'll move to approve the agenda as presented.
I'll second that.
It's been moved and seconded to approve the agenda as presented. Any comments? Hearing none, all in favor signify by saying aye.
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 Any opposed? We have an agenda. Item number 3, approval of the minutes.
I make a motion, we approve the May 23rd, 2024 minutes as presented.
I'll second.
Okay, I have a motion and a second to approve the minutes of May 23rd, 2024 as presented. Any comments? All in favor signify by saying aye.
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 Aye. Any opposed? Motion carries. Item number 4, National Breastfeeding Month Resolution. Somebody want to read it first?
You want to read it?
Sure. We're asking for the proclamation for National Breastfeeding Month, which is in August. Whereas human milk feeding is the biological norm for infant feeding and a proven primary prevention strategy that builds a foundation for lifelong health and wellness. Whereas the evidence of the value of breastfeeding to the health of the mother and the child is scientific and continually reaffirmed by new research. Whereas the American Academy of Pediatrics and World Health Organization recommend exclusive breastfeeding for about the first 6 months of life with continued breastfeeding while including complementary foods for 2 years or as long as mutually desired by the mother and the child. Whereas the U.S. Breastfeeding Committee designates August as National Breastfeeding Month, it designates August 1st through 7th as World Breastfeeding Week. Whereas recognizing and celebrating National Breastfeeding Month helps to build and reinforce the connections between human milk feeding and a broad spectrum of other health topics and initiatives. Whereas the Centers for Disease Control and Prevention publishes a biennial breastfeeding report card, which has consistently shown suboptimal breastfeeding initiation rates on a national and state level, as well as substantial decline in continued and exclusive breastfeeding as babies grow. Whereas the Healthy People Initiative consistently identifies breastfeeding as a national health priority, whereas protecting and supporting human milk feeding is essential to ensuring infant nutrition security and immunologic protection for Mason County's youngest people, and whereas the consistent and well-documented health, economic, and environmental benefits of human milk feeding show that this is an investment that will continue to produce measurable dividends across the country and our county, and many times over for families, employers, and the government. Now therefore be it resolved that the Board of Health hereby proclaims the month of August as National Breastfeeding Month, supports the goals of National Breastfeeding Month and World Breastfeeding Week, National WIC Breastfeeding Week, Indigenous Milk Medicine Week, Asian American Native Hawaiian Pacific Islander Breastfeeding Week, Black Breastfeeding Week, Workplace Lactation Week, Latina Breastfeeding Week, and supports policies to ensure that all pregnant and postpartum women and caregivers can access a full range of appropriate support from healthcare institutions, insurers, employers, early care and education providers, researchers, and government entities. And that's this day of July 24th, 2024. And I forgot to introduce myself. I'm Elizabeth Custis. I'm a nurse at Mason County Public Health, and I work in maternal child health. And also Rachel Hook is here from our WIC program to bring you this proclamation.
Wonderful.
You agreed to that.
Thank you. You know, as commissioners, we have all kinds of proclamations. This one actually makes sense. It actually has a benefit. What a concept. Would somebody like to have a discussion of this, or are we prepared for a motion to actually put this into place?
Move to put motion into place.
Okay. I have a motion. Do I have a second?
I'll second that.
Okay, we have a motion and a second to proclaim National Breastfeeding Month, August 2024. Any further discussion? All in favor signify by saying aye. Aye.
Aye.
Any opposed? I'm gonna go ahead and pass this around the table. I don't know that we have an official one, but we'll get the signatures we can now, and we'll send them out to you guys later on to get that to you. Thank you very much for bringing that to us. Okay, next up, we have our health officer report. Health
That's me.
officer,
Yes. Hi.
hi.
Nice to meet you in
Welcome.
person. Yeah.
Welcome home.
So, yeah, it's good to be here. I'm Steve Prayer. I'm the new health officer taking over for Dr. Gardner. I've been around for a couple months now. Yeah. So it's been really good to start and meet people. This is the second time I've been up to the county in person. So I'm looking forward to spending more time with staff members and continuing to get to know people. Dave, our administrator asked, for me to go over a couple topics, so I'm just gonna dive in if you don't mind. And I have a couple slides. I'm gonna keep it brief, but every once in a while, I'll just like to kind of touch on a couple relevant, I think, public health topics. So today, I'm gonna talk about two things mostly, and then obviously if we have any questions, happy to answer them. Summertime, let's see, oh good, it's working. Let me just, there we go. Excellent, okay. So a couple things. I'm gonna touch on smoke kind of at the end and just some of the things that public health do around that. One of the things I wanted to talk about was tuberculosis. We've had a few cases of tuberculosis in, active tuberculosis in Mason County. Recently, it looked like from our data, especially 2022, we had a large number of cases. So I wasn't around obviously for that. I think we've had a couple this year, one that we're currently following. So TB, just in general, is a lot of people think of consumption, we got rid of that a long time ago. Tuberculosis is globally remains, depending on the year that you look at, the number one killer in terms of infectious diseases. So more than malaria, more than HIV, it still kills a lot of people around the world. And we're gonna go over kind of data a little bit and we'll look at that. But mostly we're talking about places that don't have great access to healthcare. So we, are lucky in the US, we have a lot of kind of screening protocols in place for tuberculosis. So we don't see a ton of active cases, but we still do see some. And public health, local public health, that's a big part of our job, is keeping track of those and making sure that they get treated appropriately. So that's kind of what we're gonna talk about real quick. Okay, so I almost went too far. So what I'm gonna say TB, because it's just easier to say. It's what I'm used to saying. So it's caused by a bacterium, germ called Mycobacterium tuberculosis. That's kind of its full name. Most people think of tuberculosis as, an infection of the lungs, which is nicely demonstrated in this beautiful graphic about kind of how it's transmitted. It is airborne, so it does kind of linger in the air for a long time when someone's around someone who has tuberculosis in the lungs. I do want to note that TB can infect other parts of the body. It's not just the lungs, but we're kind of most concerned when it is the lungs because that's how people transmit it, right? So, but you can really, I've seen TB in people's bones, other organs, eyes, kind of any part of the body you can actually get TB in. But about 70% of cases are in the lungs when we're talking about active tuberculosis. So, coughing, speaking, seeing, these are all things that will kind of produce that germ. I will say, especially compared to other diseases, tuberculosis is actually kind of hard to transmit in terms of how long it takes to infect someone. So generally we're talking about people who you're sharing a room with for a long period of time, or you're a family member, you live in the same household. Transmission can occur in a shorter amount of time, but it's pretty rare. So, the chance of getting it from someone on a bus or an airplane is overall pretty low, but not zero. So if you breathe this in, it infects your lungs, and then can travel to other parts of the body. You may have heard of something called latent TB, also called inactive TB. So that's basically where you get infected with tuberculosis, but then your body kind of walls it off, and you don't develop active disease. most people with tuberculosis have latent TB. So, millions and millions of people across the world have latent TB. It doesn't mean they're infectious. It means that they could develop active TB later in their life, or if they have some condition that is immunosuppressive for some reason. But we want to know if people have latent TB. We can still treat tuberculosis if you have latent TB, but it's not as big of an emergent public health concern. But it is something we're trying to focus on, especially help primary care providers be able to treat latent TB. I want to go over this just kind of briefly. So the darker areas are areas with really high rates of TB, and the main reason I just wanted to look at this map, I want to say this is from 2020 or maybe 2019. I can't remember the exact year, but the main reason is just contrasting the dark areas. So we're talking about areas with rates of 300 to over 500 cases per 100,000 people per year, versus the US, which has 0 to 9.9, so less than 10 cases. So we're talking about places around the world that have, 50 times the rate of tuberculosis or higher than the US has. So, and we're talking about Southeast Asia, parts of Africa, Eastern Europe, parts of South America. And this is really important because when we're thinking about, someone who may or may not have TB, kind of where they're from and the epidemiology of that country is really important. So, if someone from the US that's never been in prison, has never really traveled significantly, but they have a bloody cough, okay, I'm going to be concerned about that, but TB isn't going to be as high on my list of things that I'm thinking about, compared if someone is coming from India with those same symptoms.
So based on what you're saying, there's 10 cases throughout the US and we've got 2?
So that's a per 100,000 people.
Okay.
So that's a rate. Yeah, that's a
I should
great.
put my glasses on and read farther?
No, it's okay. No, that's a really good question. So this is rate, right? So not absolute numbers. And I'm going to talk about absolute numbers in a little bit. But per 100,000 people, so gosh, I always go back to Cowlitz County.
So based on what you're talking about in how it's contagious, are we tracking the 2 that we have? And
Yeah.
is it travel related or is it
So
relationship related? I
Yeah,
think without getting into too
yeah, I
much detail,
can't-
I'm just curious.
I can't talk about details of specific cases, but in general, most cases in the U.S. are from someone who was born somewhere else. And so they were usually exposed in their home country. Or sometimes we see cases of people where they travel a lot. And so, they go home and visit family for 6 months, may have been exposed, something like that. Transmission in the US does happen, especially within households, but it's pretty rare. Yeah, it's a great question. Okay, and that's a per year, so, about, and here's the US, well, actually, we don't have the US map, I took that down, but we'll just talking about Washington specifically. This is kind of the rate we've had in Washington State over the last 10 years. So we basically kind of hover around 200. This is total number of cases. So across the state, about 200 per year. We had a little bump in 2022, and then it kind of went back down. So 2023, we had 221, so it went down about 12% compared to 2022. This is, kind of where we see the most cases in Washington. So Snohomish, which makes sense population-wise. Snohomish, King, and Pierce County have the most cases, 25, 109, 30, and then the rest of these, and I'm blanking on the name of this county over there, I should know it, the 11. Is that Spokane? Mm-hmm. Okay, that makes sense. Yeah, the rest of the counties have had less than 10. So, let's see, and then, 2023, we didn't have a case, so, let's see, okay. Again, this is just kind of looking at rates over time, over the last 3 decades in the US and in Washington. These are rates of active TB, and mostly I just want to point out that we've gone down a lot over time, which is great. we're essentially on, we used to be lower than kind of the US average, and now we're about on par in terms of Washington State. But I looked at our last 5 years in Mason County, again, with that significant number of cases in 2022, and sometimes that happens, especially if we see like a cluster around a family. I've been working in Cowlitz County since 2019, and the last 2 years we've just had, it's within kind of a specific community, and unfortunately it's just been, we've done a lot to contain it, but it's, you know, it kind of travels slowly, I guess, and it can be hard to stop sometimes.
We had a point where 85% of all our active COVID cases was in one set.
Yeah.
And they were getting together on Thursdays for the big family functions, and I'm wondering
Yeah.
if that's what that is.
I mean, yeah,
Actually, with our 5 cases, they were not related in any way. They were
Really?
completely separate cases, different families, different parts of the county, different backgrounds.
Wow.
It was a very unusual 5
That is
cases.
unusual,
So
yeah.
we couldn't even make an outbreak because they weren't connected epidemiologically.
right. That's very interesting. Yeah, sometimes we just have kind of statistical anomalies and you don't really have a good explanation for it. So that was an unlucky year for Mason County in terms of tuberculosis. So public health, we do a lot around tuberculosis. I'm going to focus on kind of the main things that we do. So, you know, trying to educate providers and help healthcare providers in terms of identifying active cases. So that's one of my primary roles, is if someone is like, could this person have TB? I'm happy to talk with them, and we'll kind of, you know, talk through how we might diagnose that person or rule tuberculosis out. Obviously, we want to know kind of as soon as possible if it is TB, so we can get treatment started. A lot of our job is kind of coordinating care, and when I say our job, I'm mostly talking about our public health nurses. I obviously support them in the ways that I can, but in terms of the on-the-ground work, they're the ones doing most of it. So coordinating medications, making sure they're getting ordered or delivered, it kind of depends on where we're getting them from, and then a lot of case management. So directly observed therapy is kind of like the cornerstone of TB treatment. That means we watch people take their medications, and this has been studied extensively. If people don't do that, they stop taking their medications, and then they develop, either their TB is not adequately treated and it comes back, or even worse, they develop a drug-resistant form. And part of this makes sense. You know, people start to feel better after a couple months. TB treatment is 6 to 9 months in most cases.
That's a
And
long time.
it's a long time, and we're talking, you know, especially when you start out, we're talking about like 16 to 20 pills that you're taking every day. Because it's 4 different antibiotics and, you know, multiple pills of each one. So people get tired of taking the medicine. So it takes a lot of education, you know, stressing the importance of, you know, continuing the full course of therapy, and part of that is watching. We now have, you know, some great technology where if it's appropriate, we can do that over video, which helps a lot. So we deliver the medications, people take it on video, and we still watch it, but it doesn't require the same, you know, level of in-person watching. So nursing assessments, you know, anything that comes up in terms of side effects, and then, you know, at the beginning of, you know, a case, a lot of it is contact investigation. So can we figure out where this person may have gotten tuberculosis from? If we can't, and then probably even more importantly, did they pass it on to anyone else? And then again, large part of my job, collaboration with providers. So getting people on the right TB regimen, looking at other interactions, how do we monitor labs, how do we monitor chest x-rays, how long do we keep someone in isolation, and that sort of thing. So it's a big kind of lift, but you know, our nurses have a lot of experience with it, which is great. Okay, TB, and then I just have 2 slides on smoke, so I don't want to take up too much more time. I wanted to basically just point out that I took this yesterday from airnow.gov, fire.airnow.gov. It's probably the best resource for like air quality. It also has fires, which are, it's kind of hard to see, but like some of these little fires are where the fires are. You can see most of our air quality problems are on the eastern side of the state right now, so those are those yellow and orange and red places. And this is kind of our air quality index, right? You know, we start thinking about the public, you know, when we get into these orange and red, but even moderate, you know, people who have lung disease, heart disease, people over the age of 65, we want sensitive groups to watch out for symptoms even during those moderate times. The last resource is this Washington Smoke blog. If you're more, it's a little more focused specifically on like fires, and this was like a nice map they had yesterday of kind of all the fires around. There's a big one in British Columbia, and there's some bigger ones in Oregon, and you know, air quality for us is just gonna a lot depend on how close the fires are and then what kind of winds look like, right? So we kind of keep a close eye on that. If you know, air quality starts looking like really poor, then we'll you know, start to educate people on steps that they can take to protect themselves. Those were the main things I wanted to talk about.
Would it be beneficial to bring Orca in to work with you and talk with you, or do anything, or do we do anything with Orca here? I'm on the board, so we can.
So, Orca monitors this stuff. We also connect through DEM. So DEM is kind of our go-to for the county and then they're our
And then
coordination
also-
point.
Also DNR.
And DNR, yeah, so we do a lot with DNR. And,
Well, they came down here and they worked with our health department and stuff at one point. Orca did, what, a year and a half ago. We were one of their pilot ones to learn how to work with the other counties.
right, and since then, the health officers got together and put together, they went through the recommendations and then we came up with our own recommendations for state of Washington, and that was what was presented.
I have a question about
Yes.
TB.
Yeah.
If you wanted a TB test in this county, where would you go?
Oh, that's a great question. Who are our best places to go?
Providers, yeah.
Yeah.
The provider?
Yeah,
Because I've
so,
had providers send them to me, and I don't do them at the pharmacy, so
yeah.
I wanted to know, where do they
So,
go?
yeah, if your healthcare provider has like a contract with like most labs, like Quest or something, like a big place like that, they can do a blood TB test. And then, you know, depending on the office, they could do that skin, you know, the skin test that you get read, you know,
Right.
2 days later.
Right.
It really just depends, yeah, it's a good question.
And typically when they're testing only after presentation of symptoms, so people are going in for
Right.
symptoms and.
Well, I had somebody come in the other day, they needed a test before a job.
Yeah.
So,
Okay.
and I didn't know where to send them, to be honest.
Yeah.
Or exposure, if they've been exposed.
Right.
And if they're, if they are an identified contact of one of our actives, then we help facilitate getting them into a provider, because that can be difficult. And our provider offices have been really good about facilitating getting them in quickly and then taking over their care if they're just kind of a latent case. But, yeah.
And we've had great coordination with the TB Center out of Seattle King County Public Health. And when we had our outbreaks in 2023, 2022, they came down, they lent us people, they came down and helped us do blood tests, and it was just great coordination. That's one thing our state does very well is TB.
Mm-hmm.
But we still
Well, it's
need to
required.
provide, if we can, look around and provide her with that actual answer of where to go, because she's right on the ground level that deals with everybody. It's a amazing phenomenon how people react with their pharmacists. They're
Yeah.
literally the catch-all for everything. It's
Yeah.
just,
All the questions.
yeah. So if our pharmacist doesn't know, we need to do something to make sure all of our pharmacists know.
And you're always welcome to call.
Well, I
health.
told them to call the public
And
health,
ask
actually.
for their- Yeah.
I gave them the right answer, but.
Yeah.
So the medication, you say 20 pills, maybe up.
Mm-hmm.
Does it require special handling? The medication does have to be refrigerated?
No,
And not for adults.
no, yeah.
Babies, yes.
Yes, there are liquid forms for kids, unfortunately, that we have to do sometimes. And, you know, we we'll package them and make them kind of easy for people so that they're taking the right amount.
At the right
But yeah,
time.
exactly, yeah.
A little piece of advice to tell them when they're taking all kinds of pills. I do all the time. I do chemo for 13 years, but I take all kinds of different pills that come along with all that. Sour Gatorade is a godsend. It does away with the gag reflex and stuff like that. The more sour, the better, and it allows me to swallow tons of them at one time and just get it
Yeah.
done. Because if you take 1, 2, 3, it's what a nightmare. So I just throw them all in and go. But Sour Gatorade, pass it on to your folks.
And one thing about TV is the county is the payer of last resort on,
Yes.
on TV.
The public
And
health
by our
is
CW, yeah.
required, yes.
Yeah.
Okay, anything more for our health officer?
Great report.
Yeah, welcome again.
Thank you.
And
It's good to be
way
here.
way to come in the door. All right, next up, we have our administration report.
Okay, so you got my, my letter, but let's go to, we're gonna talk about finance for a little bit. Let me see if I can make this work. Share screen, okay. Okay, all right, super. Okay, so, July is, for us, public health, it's our busy time because of our fiscal year. So, basically, we just completed our fiscal year with DOH. Most of our contracts run from, July 1st through June 30th, so, this gets a look at most of those things. So, on this one, 2024 is our gray line. Prior to the last 2 years, we were very predictable in our trends. So anything out of the ordinary would, kind of leapt to notice right off the bat. Since we've gotten our Foundation Public Health Services money, which comes in basically twice a year in cash, it's thrown our curve off. So our curve doesn't look quite the same, so it takes a little more digging in, a little more interpretation. But bottom line is we're looking good. Foundation Public Health Services funding has really gotten us over some problems of not having cash to do what we need. And the nice thing is it's cash in advance. The bad thing is if we don't spend it, we have to cut a check and send it back. So we send it back July 1st and we get it again later in July. It's kind of the way it goes. So this last year we sent money back because we were still using, up in late 2023, we're still using COVID dollars for a lot of things. This next year we will not be sending money back like we have this last 2 years. This just shows our fund balance, and you see the orange, we're very high fund balance, and then the treasurer took an investment out, and we now have around $4 million in investments for public health in the bank, so we're looking pretty good in that. So it looks like our fund balance is low, but think of it as that's just the cash, and our savings account is over investments, so we can pull that back at any time we need it.
Right now, we're getting high yield,
Yeah,
so
so.
high yield.
Yeah, so we're looking good.
Yeah.
Yeah. I was telling our staff, I said, this is probably the best we've looked since 2006, as far as funding goes. Here's our revenues. State funding is about 45% of our revenue. Federal is about 17%. And you see we get a lot through fees, permits. County contributions about 9%. Clean Water District, which funds our folks to go out and do the sampling along shorelines, and the transfer from mental health. Now, a lot of what funds pass through public health are not represented in this because they're pass-through funds. So the funds we have through Human Services, they're not as budgeted in here because that's not something we really access. We just pass those through to our community organizations. Our revenue year-to-date, state funding is looking good, federal dollars a little more than anticipated. The new thing is the opioid settlement. So that is new funding that has come in, and through the different settlements that we've applied for. And in fact, we just did our Kroger settlement yesterday, starting to add those funds up. So now some of those funds are a one-time payment. Some of them will go on payments for a number of years. I think the longest one is like 11 years. So we're working together with the city. So they've rolled the funds together, and we'll be going forward with that in times to come. So permits are looking good. We haven't drawn our county contribution down from the county yet. A lot of our county contribution comes in and then gets paid back to pay our overhead. So it just kind of comes in and goes back out again. Revenue versus budget. Our state funding is looking, we get another batch of money here in July. Federal dollars were looking good. Permits were nearly up to speed. So a lot of our permits, licenses are first of the year, so think restaurants, septic pumpers, all those permits come in the first part of the year, and then after that it's septic system permits and, you know, the odd food permits and temporary food permits, that sort of thing. Opioid settlement is new, and then investment earnings, that's new, so that's new for us to track. Expense, salaries and wages, that's the biggie. Benefits, second biggest one. So 75% of what we spend is salaries, wages, benefits. Internal charges, that's basically your overhead. Services are all those other things like Dr. Krager is part of our services. Intergovernmental, it's very small, but expense is actually coming in under budget, which is nice. So we're about halfway through the year and we are only about 45% spent. So we're looking good in expenses. Services, we're nearly at full part of the year, but that's kind of expected. Expense versus budget, like I said, looking good. Salaries, the biggest part of that. Operating budget is much smaller. And then internal, we pay quarterly on our internal fees back to the county, so we're due for another payment out this month. Okay, that's it for finance. Any questions on that?
Nope.
Okay,
See
if
you.
not, then I've got.
If you have any on Zoom, unmute yourself and just pop in when the time comes. Okay, hearing none.
Okay, so part of what Wasalfo and the crew of public health across the state, we're working on educating local boards of health. So that's, a couple of years ago we had new legislation which really reorganized our boards of health. And for many counties, they went from having 3 members on the board of health to 9 or more. So we were way ahead of the game in that we had a large board of health. So we just kind of shuffled who belongs to what category. So it was a set down legislation of the categories, and it wasn't difficult for us to make that adjustment at all. So we were way ahead. So the purpose, we're going to do an overview, and it's not sharing on screen. So this is a new share. Let me put this up here. Try that again. And bada boom. Okay. So as I said, it's something new we're doing for all of our local boards of health. Understand our changes, and then we're going to do a couple little practice things really quick. So we're going to buzz through this really quickly here. Acronyms, they're in your packet. We have buckets of acronyms, okay? Just lots and lots of acronyms. And the same letters here mean different things in different places, so. Biggest things are LHJ, you'll hear me say LHJ a lot, that's local health jurisdiction. That includes both districts and departments. We're a department, we belong to the county. Many places are districts, they are separate from the county. They're a separate entity, local governmental entity, and we are not that. So I have worked in both. Advantages, disadvantages. So for a home rule state, like I said, we have county departments, county districts, and the thing to take away from this slide is we have a different line of authority. So say for example the building department has their authority comes from the state through legislation to the county commissioners to the building department. For us, it goes through state constitution to the state board of health to the local board of health to the department. So it's a different line of authority than what you would have in other departments. So we fall under the rulemaking of the state board of health, and the state department of health does rulemaking, but they're really a lot of what we do, we're doing under contract for the state department of health. So So State Department of Health is responsible for all health in Washington. We're responsible for everything inside of Mason County, and we work a lot under a contract. The CONCON, you'll hear me talk about the CONCON, consolidated contract with the State Department of Health to do their work for them. If we were not here, the state would be in, they would come in, they would do the work and build the county. So, and that happened in Chelan Douglas.
Yeah.
Yeah, when their health department kind of fell apart, state came in, they put an administrator in, they put a health officer in, they put in a chief financial officer, and I think the environmental health director came from the state. Until the health department can get, actually the district can get back up on its feet and get new people in the state. So, the state does come in and do that kind of thing. This is just a map that shows you different organizations. We have Health and Human Services, so the west side state has a lot of that, east side of the state less than. You see the Northeast Tract, which is where I used to work. We had 3 counties in the district. There used to be 10 multiple county districts, and there have been a lot of divorces since that time, and a lot of places went out on their own, and so right now we've just got the 3 multi-county districts out there. Role of local board of health. Local board of health has the ultimate authority within the county. So the health officer and I are appointed by and work for the local board of health. So we are your team, we work for you guys. You set health policy, and then for us, a lot of what we get for Foundation Public Health Services is dictated by the state and by the FPHS steering committee. They decide what we're going to work on. AIS in this slide is additional important services. Those are things that are important to the community, but they're not funded by the state. And a big part of the Board of Health is to say, we need you to do these things. What do those things look like? WIC. WIC is not a foundational thing for public health, but WIC is something that's important to the community, and the Board of Health a couple of years ago said, you know, WIC left, public health step in, and it took us 2 years to get WIC up and running, and we were up and running. Thank you very much to Rachel, who's our WIC person, and we're charging along with WIC and doing great things. The community loves it. So that's an additional important service that we're doing here locally. And then again, local board of health, you are the public health policy makers in the community. So you make policy. And we're different in that because we're a local board of health, and then you've got county government, board of health makes policy, county government does the funding and all the pieces that go with supporting what the board of health decides. So, and all commissioners are on the board of health, so their voices are here in 2 places. We had 1152, which came out in 2021. Initially, it was going to regionalize public health, and a lot of us said, no. So that got rolled back, and it got changed into an expansion of local boards of health. So that's kind of where we are now. A lot of new people in boards of health, and then this is training that we're trying to do with each board of health to give them a common understanding of what boards of health do. There are statewide local board of health orientations. These are paid for in full. So if you want to go to one of our trainings, and I will be putting those out to the board, your hotel's paid for, registration's paid for, there's no cost to the county or to the individual to go to trainings. So we have those out there available, and I will put those out as we get them. And they're run by WASAFO, which is the Washington State Association of Local Public Health Officials. That's an easy one to say. So WASAFO, and Jamie Bodden is our director, and she's in charge of doing this board of health orientation.
The last time I went to was really good. So.
Yeah, it's good stuff. And it gives the people who go a chance to cross-pollinate. You know, how do you guys do it? How do we do it? What are things that are important in your community? Because no 2 health departments are the same, no 2 counties are the same, different priorities. As you saw, we had a bump in TV, so that's been an important thing for our community and for our board. Or in some counties, they haven't seen a case on TV in who knows how long. So, and we've been bringing in, you know, our experts, typically from other local public health departments, not so much from DOH, but from local public health, because DOH they just operate in a different realm than we do. Like I said, there's better understanding, they're supporting each other, and it's NALBO, National Association of Local Boards of Health. Wow, I got it right the first time. And they're trying to get established in the state, so we have, like with SALFO for public health, NALBO would represent local boards of health, where you guys could get together, talk about issues, and work through those things. So it's another information sharing, expertise sharing way to get together, and you'll be seeing that coming out too.
And many times when you get there, you find out you're not as bad off as you thought.
Yeah.
You listen to the other stories.
You think, this is crazy, and then you look at somebody else and like, man, that's crazy as that.
We're doing just fine.
Yeah. And I have to say that Mason County is we are so well supported by our Board of Health and by the Board of Commissioners. It's been a pleasure working here because I've seen places where it got very contentious. And it just has not been that way here, and it's been a pleasure working. We're very much a problem-solving set of boards here, which I really do appreciate. It's what we're looking to do now is to try to bring the Board of Health into that policy making and to take feedback from the board on what you're seeing out in the community. That's why they were selected by the types of positions, and bring that back to me and Dr. Kreger so we can put together things through the health department to address those things. So, practice, okay, we're gonna run through this really quick. We're not gonna go into huge detail. So, you know, we asked the questions, why are you on the local Board of Health? And part of this is that we've reached out to say, you know, listen, you represent a sector that we would like to have on our Board of Health. And we put that into county rule, the different sectors we're looking to fill. What motivates you, what's important to you, and everybody brings something different to the table. So here's a case study, and this is really relevant because we just did this Friday.
Yes,
So
we did.
We had kind of this thing on Friday. So it says it's Thursday before the 4th of July, because it's always on holiday weekends. I had a pertussis outbreak on Memorial Day, Friday before Memorial Day, 50 kids in daycare that went to 5 different states over the weekend, and we had to track them all down. So that's how public health goes. Anyway, 4th of July, algae in a popular lake, reports of dog deaths after swimming in the lake, water sampling reveals high levels of cyanotoxins, and it talks about, you know, they cause mild to serious health effects. What we had was fecal coliforms in the water at a couple of state parks, so we just did this Friday. Hundreds of people swimming, boating, fishing. What should be done as a board member? You know, what is your role? How do you work with the health department? How do you talk to the public? And Melissa was thrown to the wolves or to the fish, as it may be in this case. I was gone, Ian was gone, Casey was gone, and Melissa ran this Friday with Dr. Kreger, and man, they hit all the right marks and did just exactly what they were supposed to do. So, and in this case, you work with the health department, and we get the notices out, talk to people at the beaches, we put out things to the media. Dr. Kreger makes the decisions on those. At what level do you cut things off? Fallout. There is always fallout from every public health decision. Someone's not going to like it, and it's just part of what comes with the territory. And then we engage with people in this particular case at the state rangers. We talk to DOH. We talk to ecology. Who else? I mean, there's just a number of state agencies that get brought into things that happen around those lines. And then communication went out to the public. In fact, I think a newspaper talked to us this morning to get clarification, and they'll be doing a little in-depth study of that. So you'll be seeing us in the paper this next week. And then, is there a larger issue that needs addressing? And that can be, on something like this? Is the algae being fed by sewage? Is, you know, what are the other underlying issues? And that's questions that boards often ask, so, you know, what's an underlying issue in this particular case? So, case study here, so, community health assessment, this falls under Melissa and her crew, and then Jacob, who is our epidemiologist. And this one, we talked a little bit about suicide in youth is increasing. What do we do? You know, who gets involved? And how does the health jurisdiction act? And then this gets to be a lengthier discussion for boards of health, and these sorts of things are going on across the state as we speak. So there is in this particular case, I'm on the governor's select committee on suicide prevention, and that was something the board asked me to sit on years ago, and we've been working with suicide prevention across the state as a group of us from different disciplines coming together quarterly to work on suicide prevention at the state level. So, same sorts of things to think of in any situation like we had with the previous example. So the big takeaways, Board of Health, you're the policy folks. Board of Health, bottom line, everything falls on you. You know, it's an important position in the county. It's all regulated under the most exciting RCW, which is 70.05. Great reading, fascinating stuff. You should jump in there and have that just about memorized. It's good stuff. Actually, it does outline how we are governed, and it's pretty simple and very clear. And then, like I said, Dr. Krieger and I work for the Board of Health under your authority. That's where we get our authority, and then we pass ours down to our staff. And then if you want more training, we have those coming up, and if they are paid for. So if you have questions, contact me, or you can contact Jamie Bodden, who is our state director. Okay, so I will stop sharing. And are there questions? Okay,
So
you got one?
logistics question.
yeah.
So you work for the Board of Health. You said he has the final decision. Not saying this is happening, but it has happened. He says, shut down the lake.
Yeah.
The Board of Health comes in and says, I don't know. So what happens at that point, Dave?
That's when the health officer.
Besides him quitting.
Yeah. The health officer is going to convince the Board of Health.
Yeah.
Yeah.
No, we'd have a discussion.
Yeah.
Yeah, I mean, that's how I would approach it anyway. We'd figure out, some sort of compromise where,
Mhm.
you know, if I was dead set, then maybe I'd make you fire me, but hopefully we wouldn't get to that point.
We have something like that
I
right
can't.
now. Belfair State Park and Tawana, closed,
Yeah,
Tawana closed?
yeah,
State parks.
yeah.
because
For
of
swimming.
people.
Yeah. Or fecal coliforms. And those are really driven by, you know, the fecal coliforms, which are in the background.
Is that your
They-
fault?
Yes.
Anyway, and then as you get warm weather, the populations of those explode. And it happens at Allen a lot too, and a lot of it's driven by seals and seagulls and other things, so.
And for us, it's more, seems to be shellfish oriented when it comes to those type of
Right.
things.
Usually our closures are, but this is a little different,
Yeah.
especially during summer. I'm getting phone calls and people are not happy, as you can imagine. I know in Tawana, you're gonna have a lot of the animals and stuff, cause that waterway comes from the hills and a lot of animal waste that comes down on that.
Right.
Allen, we have, for years, we had issues with pigeons of all things. Huge amounts of pigeon stuff would go down and that would interfere with it. Now we have the seals in a huge, large
Yep.
number. At Belfair State Park, historically, it's a funny thing that we always had horrible issues there. And the person that put in the septics, now it's a whole new system, but the person that put in the septics many years ago found that the water table was too high and the tanks were floating. So when they put them in, they busted the bottom of the tanks out to make them sink. That's a real thing. That's what Belfair, for all
Yeah.
those years, those high numbers, that's what it turned out to be.
Right.
And I got that from the person who busted the bottom of the tanks out.
Yep,
Can I just make one other point?
yep.
I don't know the community as well as you do, so that's part of your role, right, is advising us on what you're seeing. So, you know, I'm gonna rely on you to fill me in on something that I may not realize, you know, about a decision like that. So that's kind of how I'd approach things.
I've just been on both sides of the fence. So
Yeah.
I've been on that person that said, don't
Yeah.
do this, and then the council comes in and says,
Yeah.
or I've been now the board member going, okay.
Oh, yes, you will.
Yeah.
Yep.
But in this situation, we don't want people to get in there with cuts
Right.
and get infected and
Right.
ingest it, as all kids do.
Animals.
Mhm.
Yeah.
Yeah.
Right. So, yeah, so we had an object lesson just this week, so.
Well, and kind of a great segue into that is, because it's coming up down here, but I'm gonna jump over to Ian real quick. And so, because they can test the water, they can determine what type of fecal matter it is, right? Right,
I think new DNA testing, yeah.
right. And so did they
It's
do-
not that specific, unfortunately.
It's not?
What they're doing is they're testing for bacteria that are indicator species that could indicate the possibility for there to be harmful pathogenic bacteria present. So they're not testing and saying, yes, the water is dangerous. They're just saying, there's a lot of poo present here. And for most of those three beaches, Potlatch, Tawano, and Delfair, it's usually been baby diapers, people with illness, sometimes the toilets overflowing at the bathhouse that's nearby, especially at Tawano there. It's an issue every year. We usually have, you know, one closure every year at those beaches.
That feels like that. Feels like every year we've had a closure, so.
Does anybody else feel like we're gonna jump into a rendition of Bohemian Rhapsody?
He looks like a rock star up
Yeah,
there,
with
doesn't
that,
he?
and that's that video, that's, they had that black background like that.
Yeah,
Looking up at
the
him.
room is dark. I don't know if you can kind of see.
Yeah.
It's like
That's cool.
it's a wooden room.
Yeah.
It was awesome.
So that with the light shining on my face.
Okay,
What else we got? Any more questions?
okay, moving on then. Clinic discussion. So we are in the process of occupying a building provided by the hospital.
Saw the maintenance trucks up there the last
So
few weeks.
Yeah.
cool.
So we
That's
are
so cool.
painting, we are carpeting, we are doing all kinds of work to transition those to our needs. And part of that's gonna be coming is we're gonna be doing family planning. So it is a gap in the community. Family planning left here in 2022, no notice, same thing with WIC. So there's a big gap in that. So in the next few months, we'll be coming back to the board and talking about family planning. At this point, what we're looking at is using Title 10 policies. There is no Title 10 money. So Title 10 was a federal program that paid for a lot of family planning. There's no money in that anymore. So we're gonna have to take it on as an enterprise on its own and do billing. We're gonna be doing Medicaid billing, insurance billing, cash pay, and then sliding fee schedule. So we'll be looking a lot like an FQHC as we get into this. So we'll be coming back to the board, we'll be coming back to the commissioners, talking about this, how do we fund it, where does it land in the books, what's the budget. Basically, we're looking at having an ARNP who will be working with us in our hepatitis C program, also working with us in the family planning program. So try to roll those two things together. We have funding for hepatitis C, $100,000. And working to kind of blend the funding to pay for a full-time ARNP. And that will be at that location, and that location is going to work very well for us with family and community health and human services moving up to that location. So environmental health and fiscal will stay in building 8 where they're at now. And basically all the public outreach stuff will be going up above. And will be, like I said, in conjunction with the hospital, up near the hospital, and right across the street from the middle school. So it's a great location, and we'll be up there doing our work going forward. Hopefully by the end of August, we'll be up there, but I don't see us getting family planning rolling probably till after the first of the year, because there are a lot of pieces that have to go into that, to include, you know, who do we get our electronic health records through? You know, how, I mean, there's just all kinds of things, and we'll need to coordinate with the hospital as far as, you know, how do we do a handoff from us to the hospital? You know, how do we hand off from us to Peninsula? So there are a lot of questions, and we're working on those. The second piece of that is our mobile outreach. So in the past, we've had syringe exchange through an old RV, which has kind of outlived its usefulness. It's not ever been meant to do commercial work, and we've kind of pressed into service that for the last few years, and we're going to be doing an RFP for an outreach van. Our syringe exchange never lived up to what I really wanted it to do. So, I mean, we do syringe exchange, okay, but we're going to do hepatitis C testing and treatment, HIV testing, and then a warm handoff to either the hospital or a provider. Wound care, so the way this van will be set up is we'll have a treatment room in the back, we'll have a lavatory, and then towards the front will be more of a softer feel to do mental health outreach, work with homeless populations. And this will give us the ability to take public health on the road throughout the county. So if we want to do family planning in Hoodsport or other places, we can take it on the road. If we want to do WIC remotely, we can take that on the road. And that's something that 20 years ago, public health did all over the state. We used to have an old motorhome in Northeast Tri. We were all over the place doing WIC and family planning out of our mobile unit. And it was very popular in the very small communities because they just don't get service. So this is a way for us to do outreach and fill some gaps in our community.
What's the one that's here, that's by the park?
That is a methadone clinic. So they come over daily and do methadone, and then they're based out of Kitsap County.
And they're
Out of
also,
Pierce County.
but they're also doing a needle exchange as well?
No, we're doing the needle exchange.
Because they're, all these things are, and I don't know much about this, they just show me pictures in the city of Shelton where they're using the syringes and stuff like that to smoke it.
Well, you wouldn't
I don't even-
go into a methadone clinic and have somebody hand you a syringe afterwards, so,
Yeah,
no, that just doesn't happen. So there's a disconnect there.
okay.
So they're
Like I
based
said,
in
it's a city, not
Kitsap
me.
County?
Pierce County.
Pierce County,
Pierce County.
yeah, they're up Pierce County. So they're over here 6 days a week, I wanna say, yeah, 6 days a week.
When we started this Suboxone, that was the one thing, I wasn't never a fan of the methadone. Cause I've seen different people that, when I was, younger, people worked for me that literally would just sell it constantly, and it was not the same as what we were promised with the Suboxone treatments.
Well, methadone, I work with Spokane Health District. They come in, they get their methadone treatment, they leave. It doesn't go with them.
Yeah,
They take it right there.
Yeah,
That's why they have to go daily.
yeah.
So logistics on your mobile outreach, have you ever considered a trailer instead of a motorhome? I saw, the reason I asked, I saw one, and they were touting it as it's really easier because the trailer lasts longer, and if you get a big enough truck to tow it through the county, you can just drop it at some of these fairs and things out there, wherever you take it.
Right. And I've looked at that, and I've got an RFP going out, and I joined the Northwest
That's another acronym.
It's another acronym. Northwest Remote Medical Unit Association. And we've been meeting, and I've been learning a lot. And I'm going to their big conference in September to look at vehicles and to look at, and get the education. Because it's not just that, it's the IT, do you use Starlink so you have, so you're connected all the time? There's just all kinds of facets to it.
And there's so many places in this county where you're not connected.
Right, and then Peninsula Community Health
It's,
is really all over this. They have
Right.
12 units.
yeah, and they're looking at maybe going out to Tahuya more and that.
So we're
Possible.
trying to do this in a way that we're not stepping on each other's toes, and it's coordinated, and we fill the gaps that other people are not doing. So, more to follow. And that is the extent of my report, unless you have questions.
any more questions? Okay, let's move on to the next one. Environmental health report, Ian.
Good morning, board members, or actually, no, good afternoon, board members. Apologize for not there, I am on vacation, so I don't have, and I also don't have access to any of my stuff. I tried logging in this morning. It says, your password's expired, so yay.
That's hilarious.
The first item we have up is the policy for basic sanitation. We discussed this policy at the last board meeting, board meeting. And this is the policy that basically lays out the enforcement discretion that we currently use related to homeless type encampments, people that are essentially living on properties, not in homes, but in RVs, tents, sheds, campers, whatever they've cobbled together. And we have a lot of these properties. We deal with a lot of them. And this is a joint effort with all of the code enforcement staff in the county. It's not just the public health staff that follow this policy. It's a joint effort, mostly between public health and DCD regarding solid waste, sewage, RV, code enforcement, and various zoning issue enforcement. I don't know how much, I'm hoping the board has had time to read it this time. I don't know if you have any comments or feedback on it.
Anybody have any comments or feedback? I was reading what was sitting here. No?
Yeah.
Nope, go ahead.
Looks good.
Okay. So this policy is very similar to what other counties are doing, and it's just a necessity to not fully enforce our code because the things that our code requires are not feasible for these types of situations because it says you have to have a septic system or you have to have a connection to a public sewer. And that doesn't work with a tent. It can work with some RVs, but the people that we're dealing with do not have the funds or means to ever build a septic system. About 5 years ago, you could put in if you had good soils, you could put in a basic septic system for $5,000. Now, the cheapest thing you can get in is $20,000.
But
So
also, Ian, doesn't that mean they're dumping it on the ground though?
No, it does not. In the policy, we lay out the approved means for sewage management and disposal. Many of these situations, they are using their RV holding tank and then emptying into a portable tank that they are dumping at a dumping station. Some are getting an accessory holding tank from companies like AAA, where it's like an accessory tank that goes outside of what they have. In the most desperate situations, they are using buckets and then disposing of their waste as solid waste because they don't have a drinking water connection, so they're not generating lots of liquid sewage. They're just generating solids, which are then disposed of as solid waste.
Where?
But
Yeah.
in the garbage can or at the transfer station.
That's what we're hoping for. Is that our goal?
Our goal is for them to not dump it on the ground, not put it in the stream, which is what a lot of them end up doing when we first find them. They've dug a hole and they just have a pit where stuff is, or they have it draining away to a stream, or they've installed some kind of jerry-rigged illegal septic system. And then we come in and we say, here are some methods that if we don't see sewage on the ground, we're going to defer taking enforcement action against you.
And that's what this policy does, correct?
This policy is formalizing that. We've been doing this for years and years now. I'd say probably 3 to 5 years. But the information's in my briefing. But we've been doing this now. This policy is my attempt to have this be an open discussion for the Board of Health members so that we can get some kind of either formal approval or we can discuss what to do instead. This method is what our code enforcement staff have been doing, like I said, for a good number of years now. It's the only way we can keep ourselves from having a 1,000+ caseload.
Well, you're still gonna have a caseload, right? Because you're still gonna have to go out and check on these people.
If they're in compliance, then we are typically closing our case. And if we get another complaint that they are out of compliance, that is when we hold them to the full requirements of the code. So they don't get a second chance if we find them being, not following our guidance again.
And this is all complaint driven, is that accurate?
Everything code enforcement in Mason County is complaint driven.
And Ian, are you working with the city with this as well?
The city is typically not included most of the time. They don't have any kind of health code requirements. They do have some solid waste stuff that they deal with, but when it comes to the sewage side of things, the city just leaves that up to the county.
Because I noticed that there are some in the chart, said that, I'm looking for it here, but it talks about the city of Shelton, it's the basic standards for non-permitted living conditions, table 2. So it says that, the temporary encampments, so I'm assuming that that's if the city had one.
Oh, yes, so a temporary encampment, that is a standard for some organization to create. So there's a bunch of different definitions in there. There are sanctioned temporary encampments. So that would be something that's basically sponsored by a nonprofit organization, or it could be the city of Shelton, somebody, and that encampment has to have standards. There's examples of those in many cities throughout Washington. The city of Spokane, and Seattle's got a bunch of them. Tacoma has them, and they're a sanctioned place where they say, okay, homeless people, you will be here in this fenced area, and we have banks of porta potties and showers. That's that portion. We added that portion because we don't know if we're ever going to have a situation that we will encounter that, but that was a portion from policies from other jurisdictions that we thought we don't have any of those right now, but we might as well address it in here so that if the city of Shelton does decide to do something, we'll have some kind of basic guidance for them that's consistent with other jurisdictions.
Yeah, no, that's good, and I know that there was talk at some of the encampment meetings that we went to, their homeless meetings, and so,
Over the years, there's been quite a
Over
bit
the
of talk about
years,
doing that to
yeah.
the city.
yeah.
So it's
No,
back to the city part of this. If somebody's living in a trailer on property in the city and they're dumping in buckets and putting it in the garbage can, that complies with all this. Is that accurate?
Potentially. The city has their own requirements. If the city says you're not allowed to do that, the city can do what they want with that.
Because most of those
But
are zoning
basi-
requirements more than they are
the-
health requirements.
The county is not going to pursue a code enforcement case against that because they're not just dumping it on the ground. This gets to a contention that the county and the city have, where the city will have someone with let's say a mobile home that has a sewage leak under the mobile home, and it's flowing out across the yard down the street. The county says, not us, even though it's going into their public sewer system. And we have occasionally had to open cases to address those sewage issues in the city. The city just doesn't have a regulation that addresses that. So they leave that up to us. Everything else, for the most part, code enforcement wise, if someone complained that someone was, pooping in buckets and putting it in their garbage can for Mason County Garbage to haul away, we wouldn't open a case against that. That would be in the solid waste realm, and the city does have solid waste regulations.
I'm sorry, I don't mean to put you on the spot on this, it's just questions come up, and I know it's not you directing. Miguel, has the council talked about
I'll answer
this?
anything the best I can here, and if not, I can research it more, but that's been our
Yeah.
relationship with the city, is if a sewage issue happens inside the city, then we will address that. But if it's something solid waste related or anything else that code enforcement related that the city does have a regulation for, then we let them enforce their regulation. We don't typically come in and try to
Right.
enforce our regulations at the same time as they're enforcing their regulations.
So I'm curious, after the last meeting, Miguel, did you bring this to the council? Has it been discussed there at all?
We did. We are following the lead. Troy is exactly right. We're looking for what other jurisdictions are doing, and Troy has it exactly right. What he reported is exactly right. We are still looking around, searching for answers. We just now, had a few months ago, replaced our own code enforcement officer. So we're behind, but we're catching up. And we're looking for long-term solutions, but there's just, we'd like to expand maybe ourselves with treatment plant in the future, but another, maybe use that as one way to process solid waste. But we have nothing long-term future, but I would like to sit down with Troy and talk about the long-term. But at the moment, we're just trying to do the best we can with what we have.
Well, I was just curious if the council supported this from the city standpoint.
I'm sorry?
I said, I was just curious if the council has talked about supporting this from the city standpoint.
We not as a council, but in discussions with other council members and the city manager, is that we are where the county is right now. We're looking to see other examples of what to do, and we're following the county's lead.
So they haven't talked about it.
So just for myself, you know, we've been talking about this for a while and different things about it, and the more that we get into it, the more it actually bothers me. I'm just gonna throw it out there for myself. We keep getting these situations, and every time we turn our back, it doesn't get better, it just gets worse and worse and worse and worse. This is also a situation though, we're gonna be dealing with somebody that's out there in an RV that is, you know, spilling and doing stuff, we're gonna let that go, but yet the person that tries to follow the law, that actually has a septic, that has a problem, is gonna have to fix it. So they're gonna be held to a higher standard and a different standard, they're not gonna let them go or find another way, oh, you can go ahead and take it out to the trash can. It's not gonna happen. You're gonna spend that money to fix it, you've got a home, you're gonna have to fix it, that's just the way it is. That's, just wanted to let you know, I have an issue with that. I'm not standing in the way of anything right now, it just bothers me every time we talk about it, and I thought I'd share that. Other comments and ideas?
Commissioner Edelin, I share your qualms about it, and I think we need to actively pursue a solid, long-term solution to this. And I'd like to work with Troy and the board to find a solution to our solid waste problems.
Yep, no, and, Ian, are you good about reaching out to the city?
Yeah, but it's still, this policy does not really affect the city.
Okay.
I'm happy to work with the
Yeah.
city on this.
I just meant more for advice, to talk to him
Oh,
and give him advice and
Absolutely,
a
yeah,
little
I'm
leadership.
available anytime, of
Advice and
course.
partnership.
Yeah.
Thank you, Ian. I'll be in touch.
Okay,
Right.
there you go.
So as far as this policy goes, like I said, this is what we're doing now. If the board, or sorry, if the board likes this, then we will continue to do this. If the board does not like this and wants to find another solution, we can work on that. But like I said, right now our biggest issues, and this is code enforcement in general. We don't have the resources or the prosecutor support or the court support to prosecute these cases. It is impossible for us to take these cases forward. I agree with you, Commissioner Netherland. I came from another jurisdiction where I had full prosecutor support and support from the judges, and I was in court every month, and we would get an ultimate resolution. If the person ultimately did not comply with our requirements, they were then in violation of a court order, and if they were in violation of the court order, they got a bench warrant out for them. Something ultimately happened. But in the situation that we have right now, when these cases do go to court, it takes years and years, and the judges don't support our cases even when they have prosecutor support. So here in Mason County, we don't have enough prosecutors to take our cases forward to even get to court. That's our current obstacle. But when I've discussed with other jurisdictions that have full prosecutor support, they have a dedicated prosecutor that prosecutes their cases, when they do get to court, the judge says,
Remember that.
this is not worth our time, essentially. Why are you wasting your time with this? And they don't get anywhere. They will finally get there after 7 to 8 appearances in court, because a judge will finally say, I'm tired of seeing this come across my desk. I'm finally going to tell you to actually do something. But it's still like I said, it takes many, many years
But that's code enforcement in
7,
general,
8
it's been that
times
way for years.
for them to get them to do something.
I totally sympathize with what you're saying, absolutely. But that's been code enforcement issue for many years, it's not new. To get the support from the judicial system has always been an issue for code enforcement, from housing to other things. And Netherland caught on it just now, Commissioner Netherland caught on it just now, you said dedicated prosecutor. Hypothetically, if you were to get a dedicated prosecutor for code enforcement, because you said we have no recourse, we have no nothing, well, the whole judicial system is that way right now, legal system is fighting that, you know? We decriminalize things because we don't have the resources to follow them. And I think there goes hand in hand education and enforcement. And it's just tough for me doing that for a career going, let's look the other way. And again, I'm not nailing you on this, I understand where you're coming with on this, but it almost seems like if you took what we just talked about, maybe a partnership with the city and the county, and said, let's get a dedicated prosecutor that can run with these cases.
And if we can
And
get
somebody,
funding
yeah,
from
Dave
Dave,
she
Yeah.
caught it right away and looked at Dave, and Dave believes he could find the funding even to do it.
And even if it's on a contract basis
Yeah.
with a prosecutor.
It kind of would have to be.
I
And-
think
'cause-
limited attorneys that we have.
Because
throughout
if you could
entire
find a
state and
contract
nation.
attorney to
Yeah,
take it.
I think-
And the other part of that is the court of public opinion on this. I really have a hard time believing there's gonna be support out there in the community to say it's okay to poop in the buckets and dump them in the garbage.
Or in the streams.
because,
or.
You know, we just talked about it with, this is the responsibility of the Board of Health. And to make these difficult decisions of do we support it, do we not support it, how do we move forward with this?
Well, and there's one other part to throw to it, and I don't like to mix different things that are going out in the community, but counties have, and so do cities, have authorities to create certain misdemeanors with a structure around it for
Or
how it
even
gets punished.
infractions.
Yeah.
Infractions or
But it
even.
gets set up for how it gets punished. You don't have to, if you're setting up your own, you have different things as long as it doesn't violate what it does at the state
Because you
level.
talk about, you don't have the resources to do it, but you said they won't get a second chance. Well, then you're right back to the drawing board again, doing the same thing again. And if we don't have the resources, what happens in the second and third chance?
I can address all your points, if I can remember them all, sorry, you made a lot of.
I'm sorry.
As far as, so the buckets thing, you're focusing on the lowest denominator, that is not the main situation that we face. Most of the time, we're allowing someone to use a Sanican or a chemical toilet, whatever you want to call it. And that's the most common situation, but that is not allowed by the code. The code does not allow you to use a Sanican legally. So in most situations, people are using a Sanican, and that waste is being disposed of as any sewage gets disposed of by the pumping company that services that Sanican. So the buckets thing is an extreme situation where we've had a situation where there's a person who's dying of cancer. They can't even afford the medication to help them manage their various medical conditions. They're living in a tent, and trying to prosecute them and take them to court is an impossibility. So we've said, can you at least do this? Because
Agreed, I agree.
We can't have sewage on the ground.
I agree with that 100%. So are you saying the code now, if have a Sanican on my property, that doesn't follow the code? As long as it's pumped legally and everything goes as,
It does not follow the code.
see, now that, I could sympathize with that one and go, okay, if I'm living in a trailer, I have a Sanican, it's pumped through AAA septic or whatever through the proper channels, I could stomach that. What I can't stomach is the leaking RVs,
Yeah.
the people pumping it onto the ground, especially since we just talked about what happened in the parks and the waterways. You know, and so I guess it's almost I don't know, bifurcate it into two different things because,
And bear in mind, that Sanican is actually very expensive.
yeah, it's not cheap.
No, there's a lot to it, but then again, on a home, you got the same issue, they gotta fix that septic, they're not gonna be allowed
Yeah.
to use a Sanican either. That's what I'm saying, but we'd never allow that, we would give a do not occupy.
Right,
you-
you
you're-
do
but-
not occupy, yeah.
You're much more the expert than I am on this, but from, again, looking at public looking in, the Sanican issue is the public's probably going, okay, that's reasonable. However, I don't want my neighbor with their drain coming out of their RV onto the ground out here into my well water and into the creeks, rivers, etc. And again, it is an extreme, but it's a reality of the bucket and the other things going on. And so it almost seems like, I don't know, separation of the two. Does that make sense to you?
Well, this is exactly the purpose of this discussion. Where does the board want to draw the line on what's acceptable and what's not acceptable?
I see a signature page on this. Is this something you wanted an action from? Or is it something that we, I think we need to
That is
discuss?
just, that any policy should be approved by the Board of Health.
Correct.
So that is the purpose of that signature line. I'm not necessarily asking you to sign that today. What I'm asking for is just, like I said, to be able to discuss this like we're doing now.
Okay, can we continue this discussion on our next board meeting, folks? Is everybody comfortable with that?
Yes.
Yeah, well, and Ian put everything in to our packet, so if we can, and I know that we started this discussion back in March, right? Right, Ian?
Yes.
And so if we can actually get people to maybe take a look at it and give you comments, maybe, is that what you're looking for?
That would be great.
Okay,
We could
That's
do
the main reason here is, you know, if there are portions of this that you read specifically and you say, I don't like this one thing, or what about this situation, you know, is there a portion where the policy doesn't address something? You know, that's the type of discussion that I'd like to have and to understand where you have certain things you're not comfortable with. You know, I don't like the inequality there when it comes to a homeowner does have to fix their septic system where they get to do an unoccupied versus someone who doesn't have a house gets this other option. But like I said, the reality is the person in the tent can't put a septic system in, and they can't get a connection to a sewer system that doesn't exist. So how do we protect public health by keeping their feces off the ground?
And Ian, as you said, that's the extreme on the other side. There's a lot in between though. That's the problem I have. And mine isn't as simple as just a line as, you heard my argument, and I don't even know what to do about it. I just know those are the issues that I have with it. And it
Yeah.
bothers me, the more we get into it, the more I think about it, and the more I try to figure how that actually is gonna work, or will it just keep getting worse and worse and expanding? And that's not a solution either. So I'd like
Well,
to.
I can tell you that just, from a data standpoint, and I can get numbers for you together, but our on-site septic code enforcement officer, she's the one that mostly deals with this issue. She has been aggressively enforcing this policy when it comes to no poop on the ground and requiring Santa cans, and our caseload has come way down because she's been able to get people to, in a sanitary manner, manage their sewage and not have not fall back, because these people don't have, they're not just hidden somewhere where we don't know about it for the most part. They have neighbors that made the original complaint and said, hey, they're doing this, and they have eyes on them all the time, and if they relapse, their neighbors are gonna call us and tell us, and we have not had.
Wholeheartedly agree. And what you're talking about is what I just said, education and enforcement. Both. And they're doing a fantastic job. Nobody here is worried that they're not doing their job. I think that's a whole different. But I think Dave just mentioned it, and Chairman, I'd like to make a motion if possible that we table this and have a special meeting dedicated to this subject so we can all provide feedback on this rather than drag this out for the next several hours.
Can I get a second on that?
second.
It has moved and seconded that we table this until we come up with a further date to have a special meeting on this. Any further discussion? Hearing none, all in favor say aye.
Aye.
Aye. Any opposed? Motion carries. We're gonna go ahead and table this till then. We'll do a special meeting, at Dave's request. We'll look at doing that. Please keep in mind, one of the things for me, I may even be open to having a discussion about having an allowance for Santa cans. I actually like that idea. It's at least an actual thing that we keep it off the ground, but that's for that further discussion.
Hopefully it's not when you're on vacation, Ian.
Yeah.
So So instead of having
Yeah,
a
I
special
don't take
meeting
many, so,
where we
uh,
just
All
don't
right, so
talk
the
about
next
it.
item I have then is
Hold on, Ian.
a application for on-site sewage advisory committee membership for Keith Fuller. He wants to renew his position.
Hey, Ian,
Ian, hold on one second,
Sorry.
please, go ahead.
So the only way that I would say that I mean, I absolutely want a special meeting dedicated to this, but the only way that I want us to come to that meeting is prepared. And I'm talking about myself.
Yeah.
And so if we could, if we review this and then send you guys our comments, and that way when we have our next meeting, we can have pretty much all of this.
and we can get you the data to show the scope of what's going
Okay.
on.
And it
Yeah,
would probably
that
be
would-
helpful, Miguel, if maybe even you invited the code enforcement from the city or Mark to come sit on it, and that way, at that special meeting, there's no miscommunication back and forth between the two.
Absolutely, great idea.
Okay, all right, Ian, what do you got next? We're running out of time.
The next is the application for renewal for the on-site sewage advisory committee membership for the realtor position. Keith Fuller has submitted a application to renew his and serve for another 3 years.
Can I have a
would
mo-
move to
On-site sewage
approve.
advisory.
okay,
And I'll
I-
second that.
I have a motion and a second to reapprove him. Any discussion? All in favor say aye.
Aye.
Any opposed? He's reappointed. What else you got?
Yay, thank you. All right, the last one unfortunately is another long one. This is another item from March. And this is, we had a request from several business owners in Mason County that want to do a version of street vending. Thurston County currently allows this. It's allowed through the food code through a variance that would have to be issued by the department. But it's essentially a temporary event that's not at a specific event. So, Oyster Fest, for example, you have various people that are selling food. Those are temporary events. They want to do that, but not at a sanctioned event. The requirements for them are more stringent than what they are for a special event. But like I said, this is currently being allowed by Thurston County now. It would not be allowed in the city unless the city decided that they wanted to allow it in the future. But this is just, is this something that the board is supportive of, not supportive of? There's not really a public health concern for this. This is more a policy decision from the board. There could be some members of the community that are upset by this because they spent the money to purchase a food truck or a brick and mortar facility. So there's that to think about. One thing that we had thought about doing is, a poll of some kind, but that's if the Board of Health is at all okay with this idea or not.
This came to the commission. I didn't have an answer one way or the other, but my main concern is just safety. Just making sure that if it's done safely. One of my favorite Mexican places to eat is at Silverdale, this old bike shop outside there. They have a burrito taco that's just to die for. If that disappeared on me, I know it's not affected by this, but they're not a full thing, but I wanna keep going back there, and I've never gotten sick. What does everybody else think about that stuff?
I am for it, and I'm actually for a dedicated location where they're not running portable generators and everything. I would like to support small business and have temporary orders of temporary use permits to do that, if we could.
I think they kind of have to run generators, wouldn't they?
They
Because
do.
they're not,
Sure.
Well, I'd like to have a location where the city or the county sets up a generator, and then we rent out that space somehow.
Yeah, he's thinking about
with
things
some
like they do in
dedicated
Portland.
generators,
like they do the whole.
and then
Yeah.
people can
And a
have
whole block.
a place to go to when they know there's gonna be a
That's
food
cool.
truck there at any time of the day or night. If you're working at the casino, there's not much choice at 3 AM except, a 24-hour place up the hill, but, I'm just saying.
It'd be interesting to look at that. I don't even know if we have that in our code.
I'm for having small businesses go out and do little pop-up
Food
events.
carts.
And I'd like to support that by
Hot dog
having a
cart.
location where we're not having to run portable generators as well.
Gotcha.
That's how far I'd like to go, and I'd like to support the small businesses as much as possible.
Okay, thank you.
So like a hot dog cart can be propane powered, I mean, there's
Right.
any number of things, you know, like I think about what I've seen in New York City with,
Yeah.
you know, little food carts that get pushed around.
I always see those like the bigger, Canada has them. I mean, not too many people get sick there, so
Well,
it's gotta work.
in Oregon, it's everywhere for everything, there's all kinds of different stuff. But I think the things they're talking about are the things like that restaurant that's in front of a bike store in Silverdale, it's a pop-up thing that they just go out there. In California, it's even much further than that, you go down there, you're gonna drive down the street, and it's right in front of their house, they got a tent going, they've got pots with tamales and everything else, and it's actually legal.
But on here it says no on-site food prep, so that would be, what is that definition?
So what that means is anything that's prepared beforehand has to be made at a commissary kitchen. So it has to be made in a food kitchen that's already a permitted facility.
Now, what
So
would
they
that
can't
look like
do
for
on-site
hamburgers?
I'm sorry, can you say
What
that
would
again?
that look like for hamburgers? Cause I know what you're talking about there, most of the stuff has to be prepped and everything else in a nice sterile place. But what about hamburgers? That's raw meat, and I don't know they could cook a hamburger under that
Not for,
code.
Microwave.
I'd have to
It says cooking
look into it again.
equipment
Like I
and-
said, I don't have access to any of my stuff, so I can't
Okay.
scrutinize the policy.
No,
But
I found it.
The
Found it.
answers are all in
It's
In
here.
the
She found
document
it,
that's
she,
in the.
she found
the,
it.
So it says cooking equipment and hot holding equipment vary depending on the menu items, but can be barbecue, smokers, fryers, grills, crock pots, roasters, etc.
Yeah, so you wouldn't be able to make something really elaborate. The menu is very limited on what you can do with this type of facility.
So it's very different than a food truck.
It is, yeah, it's not a
Well,
food
more
truck
than
at all. It's,
anything else.
food trucks are already allowed, we already allow food
Like
trucks
going
in
to the
Mason
school
County.
cafeteria. You know.
This is like I said, think of it like a temporary event like Oyster Fest, where someone sets up something in a tent, and then they take it down every day. It has limited hours they can operate, they can't operate for more than 4 hours a day. The menu is very limited, they can't have more than a certain number of items on their menu, they can't get really elaborate. If they wanna get really elaborate, this is intended to be a stage where they can dip their toes into food service as a business opportunity, and they can expand from there without having a huge overhead or huge amount of investment they have to put in first before they can even try it out.
But currently you have the 21-day permit, and that doesn't require an actual event.
It does. We have people that are in violation of the event requirement, if that's what you're thinking of. There are people that are in violation of the
Yeah, it
event.
actually says on, it's been a long time since I've seen it, but it actually says on it had to have a specific event connected to it, because I don't remember that. I remember seeing
does.
it, okay. Yeah, share that with me so I can see that for the future, but maybe that's what you're talking about doing, is expanding on something like that, but instead of 21 days, maybe allow them 50 days or something, and in a
Well,
year?
what this request is for is to allow that type of vending, but not connected to an event like Oyster Fest or Forest Festival.
So your hand washing, your hand washing facilities, and that will be a requirement?
The hand washing facility, I believe, is equivalent to what's required for a temporary event, which is, it could be a thermos with hot water
Right.
and a bucket.
yeah.
Soap and paper towels.
Yeah,
Okay,
yeah, that's
again,
why I tried to give the example of if you picture Oyster Fest,
That's a
But-
great example.
but just a person by themselves at say the corner of say out in Matlock, someone setting out in Matlock to cook under a tent. That would be an example of an event, and that's a specific example of what one of the individuals who's requested this wants to do. They want to set up some remote location food options for people, and out towards Cushman, set up some options out there too.
they had a Lumpia person in Belfair that was awesome.
There's that person that had it down here,
I was
cause
gonna say
man,
downtown.
they were so good.
Now I'm
Oh my
hungry.
God.
Let's go to lunch.
All
So,
right.
so hey, could you draw us up with, what a straw dog of that would look like?
a straw dog is like.
The actual thing,
Policy.
the actual policy with the sign-up sheet. Application.
It's exactly what's on that, in that document is exactly what would be allowed. It's basically a copy and paste of what Thurston County allows.
Okay,
I think it looks good.
Yeah,
I think it looks good, Ian.
I like it also.
So do we wanna do a motion
Yeah.
or go for it?
I make a motion that we approve the policy that Ian has presented for street vending.
And I'll second.
okay, it has been moved and seconded for the approval of the street vending, policy that is presented to us. Any discussions?
Good job.
Okay. All in favor signify by saying aye.
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 Aye. Any opposed? Motion carries. What else you got for us?
That is all I have. I wish I had, I don't wish I had Mark.
Okay, so I hate to do this, but Melissa, can you do it on a short form?
I don't have a lot anyway, so actually I wanted to start, before I deep dive into this, Rachel and Elizabeth, thank you for coming. They actually came prepared with some data to support the proclamation that we had for this month, and then also, if you want to do the honors of sharing what our caseload is for WIC.
Yes,
please.
I'm so excited. So yesterday, after 4.5 months of our opening, we met the state caseload goal of 300 participants, and we're at 305 as of today.
Oh, that's
So
so
I'm
cool.
super excited. And then the last thing I wanted to share was some breastfeeding rates. So there for 2023, the national breastfeeding percentage is 35.9%. Washington State is at 47.4%. And Mason County Public Health WIC is at 56%. So super excited. We have great breastfeeding support in Mason County.
That's
The
awesome.
hospital's amazing. But I also wanted to say the National Healthy People goal for 2030 is 54.1, and we've already surpassed that in Mason County.
Good deal.
We are so amazing. You.
Oh,
Oh my
I
gosh.
am so supported.
Yeah. Yeah.
That's what it is.
God, that is so cool.
Okay.
Do
What
you
else?
want to share about our event on the 2nd?
Oh, yes. We're gonna be celebrating at the WIC office, National Breastfeeding Week. So we're celebrating on August 2nd. We've now invited over 50 mothers that are on the WIC breastfeeding program, and 10 of them are breastfeeding toddlers.
Wow.
Yeah,
So can you send us information? Because I would love to just pop in.
absolutely. Yes,
Yeah,
we would love that.
okay. Thank you.
Okay, what else you got for us?
Just my report. Are there any questions about my report?
Any questions?
Focus on anything? Okay.
I got one in regards to your housing and homeless. When I'm looking at this on the funding allocated of 406,000, and then there's 57
Household.
households, so we're looking at about 3,200, with the remaining funds, we're looking about 3,200 per household.
Correct, yeah. So I think the subsidy is for 2 years. So the math would work out for that one. Is that your question?
Yep,
Okay,
that was my
perfect.
question.
Actually, regarding housing and homelessness, so we just put out an RFP last month for additional, about $512,000 additional from the Department of Commerce. The Housing and Behavioral Health Advisory Board will be reviewing those applications tomorrow. We received, I think, from 4 agencies, and the purpose of those funds was to really kind of expand the existing programs that we have. I believe eviction prevention is one of them. Another one I wanted to kind of highlight a little bit in the few minutes that we have is, I've gotten a lot of questions about our law enforcement assisted diversion program. I'm in the process right now of working with Olympic Health and Recovery Services to speak to the board, kind of about where they are, what new things might be coming with the additional dollars that we got for this fiscal year. The
Which board?
policy, what's that?
Which board are you planning?
Commissioners, but I can coordinate to have them at the next Board of Health if the board. And to
I
speak
think that-
also, not just on the LEAD program, but also on the co-responder program.
One thing that's interesting on that, I'd like to see where the actual connection is. The sheriff's department is saying they're not doing any of this, so it's interesting that we have this
Sure.
connection. They're saying they don't have the time or the ability to be doing it, and apparently we're doing a lot of it, of their stuff without them, so.
I think it depends. I think law enforcement, like I know because we've had to call the co-responders for me. It depends on, sometimes when there's high utilizers, they'll have in their notes, law enforcement must go with them. But I think the co-responders are completely capable. They do a lot of calls without law enforcement because it doesn't really rise to that level of a violent offender or that kind of threat. And it's a lot of the same people.
Yeah, it's just that to us, all this time that I've been looking at it for this whole length of time, I was thinking that it was a great interaction of everybody, only to find out it's all on one side of the house was a little bit of a surprise.
That would be a good question for Olympic Health and Recovery Services. I think it'll be really helpful to actually, if we can plan ahead, have the actual co-responders be there to present, would be very helpful, so I'll coordinate that. And we do have, so this Friday, the policy coordinating group was essentially a decision-making body for the LEAD program, is meeting again, I think they meet quarterly, to discuss a couple of things that really kind of impact the purpose of the program in our community and how it's working. So legislation really impacts what's arrestable, what law enforcement can do when they're on scene, what the co-responders can do. The PCG, another acronym, is meeting to discuss some policies around maybe what charges might we want to consider having eligible for the program. There's a lot of charges that are immediately, this person is denied because they have this charge. Could we be a little bit more flexible? I spoke with, I had somebody actually call me who was a client in Thurston County who was a lead participant in Thurston and wasn't eligible in Mason because of the charges that he had. Spoke with him, had a really long conversation about, it's been 25 years since I was charged. So those are the kinds of scenarios that the group will talk about to see if we might be able to include charges that weren't included before.
And what's required by the state, because some of those LEAD programs, there isn't a specific requirement that they did this, they have to go through this specific
Correct.
organization. That's one of the downfalls of it.
So we'll have some good conversations there. That's pretty much all I really wanted to kind of do the deep dive on, if there wasn't any other questions.
I like the locking bags too. Did you touch on that one?
Yes, so actually, Ben Johnson, who, he is the coordinator for our Substance Abuse Prevention Coalition. With dollars from that, we were able to purchase, I don't know how many locking, I think 150. Locking bags, worked in partnership with the local marijuana shops to actually have them there to give them out to customers. We actually had them at the Bite of Shelton booth this past Friday. They were probably the first thing to go. They were very popular. So I think we might be able to do a lot more of that in the future. That'd be cool.
Any other questions for it? Hearing none, we'll go ahead and move on to our next one, other business and board discussion. Board members, do you have anything you want to add or discuss?
Since we are quarterly, do you want to expand it from an hour to 2 hours?
Yeah, well.
I mean, we're here at 2 hours almost anyway, so.
Yeah,
Yeah, I don't think we need to, we just do what we do.
and could you get out the date that we're gonna meet with Ian soon, so that I
Yes,
can
yep.
plan?
Yep.
All right, any other board discussion? Then I'm gonna move right into public comment. Hi, public. You don't have anything? Okay, is there any public on Zoom? No? All right, then we're gonna go ahead and, we're at the end of our meeting. I'll entertain a motion. Oh,
Come to our walk at Shelton Saturday, this Saturday.
cool. All right, I'll entertain a motion.
So moved.
Second.
Move to second, we adjourn. Hearing no objection, we're adjourned. Thank you, everybody.
Commissioner, before this gets lost.
Except for